looking after this little one and watching her grow up.
I think access to care improved my life in terms of giving me the power to care for myself, to have diabetes specific needs met, and it had a positive, I think, outcome on my mental health.
The access to healthcare changed my life because I did not need to worry, and I have my medication at hand.
I think
It's
access to
there,
care
and it
improved
changed
my
my
life in
life
terms of
because I
giving
feel
me
better.
the power to care for myself, to have diabetes specific needs met.
In our rural
it had
area,
a positive, I
beyond
think,
the
outcome on
city
my mental
areas,
health.
they have no availability of
The access
counseling,
to
education,
healthcare changed
or
my
others.
life because
A lot of people
I
do not have
did not need to
access
worry,
to
and
care.
I have my
It's
medication
quite a
at
challenge to
hand.
find that. I think
It's
access to
there,
care
and it
improved
changed my life because
centers
I
are
feel
out of the
better.
market. The
Some
power
people
to
have
care
access
for
each
myself,
3 months, but
to have
some people do
diabetes
not
specific
have access
needs
to an
met.
endocrinologist
In
at
our
all
rural
It
in their
had
whole
a
lives.
positive,
The only thing
I
that
think,
makes
beyond the
pregnancy
outcome on my
city
mental
areas,
health.
they have no
cost
availability
than
of
anything.
The access
counseling,
to healthcare
education,
changed
or
my
others.
life because
A lot of people
I
do
did
not have
not need to
access
worry, and
I think the
I
biggest
have my
thing now is
medication
quite a
to
challenge
at
to
hand.
find.
access
I
to
think
It's
access
there,
to
the
care
and it
basics
changed
like
my
insulin,
life
insulin,
because
blood
and
glucose
I
gives
feel
protein
better.
becomes available
the
for
power
everyone.
People have
to care
access
for
each
myself,
3 months, but
to
some
have
people do
diabetes
not
specific
have access
needs
to an
met.
endocrinologist
In
at
our
all
rural
It
in their
had
areas,
whole
a
lives.
positive,
The only thing
I
that
beyond
makes
think,
the
outcome
pregnancy
on
city
my
areas,
mental
challenging
health.
more
they have no
cost
availability
than
of
anything.
The access
counseling,
to healthcare
education,
changed
or
my
others.
life because
A lot of people
I
do not have
did not need to
access.
worry, and
I think the
I
biggest
have my
thing now is
It's quite
medication
a
at
challenge to
hand.
find.
access.
Kita pong video. Ayun, ganun.
Hindi, papakita mo na ako.
Ayun, kita mo.
Tapos mamaya saan ko pipindutin?
Ano?
Dito.
Yan, ganyan yung
Ah, okay.
We'll start in a couple of minutes. Please stand by. Um, good, good evening, Doc Jonas. Thank you for coming also. Good, good evening, Doc Jonas. Thank you for coming also. Good, good evening, Doc Jonas. Thank you for coming also. By the way, ladies and gentlemen, before we start, I would just like to inform everyone that we are live on YouTube and in Facebook. Good evening, Doc Jonas. Thank you for coming also. By the way, ladies and gentlemen, before we start, I would just like to inform everyone that we are live on YouTube and in Facebook. Good evening, Doc Jonas. Thank you for coming also. Doc Rolly?
Okay, good evening.
Doc Rolly, go ahead.
I cannot unmute.
We can hear you already, Doc.
Feedback.
Doc Rolly, you and Gwen are already unmuted. Thank you.
A pleasant evening, fellow Lions friends, ladies and gentlemen. Welcome to our Lions Club's International District 301D2 World Diabetes Day webinar and press media hour with the theme Access to Diabetes Care. Good evening, Lion Doc Rolly.
Hello, Lion Gwen. You look good and beautiful as the evening. And thank you for our partnership tonight as co-host for our World Diabetes Day virtual event. Lions and Leos across the globe in more than 210 countries are raising awareness for diabetes, a condition that affects 537 million people worldwide.
Yes, Dr. Crowley, you yourself, being an insulin-dependent diabetic and an advocate for diabetes awareness together with your home club, the Quezon City Cubao Lions Club established your signature service activity since 2017 by initiating annually this remarkable observance of the World Diabetes Day that inspired more of our fellow Lions and Lions clubs in the Philippines. This year, it is not simply a district-wide event, more so now actually, a multiple District 301 Philippines undertaking. I must personally congratulate you for indeed championing our cause. As it says, where there's a need, there is a lion.
Yes, Lion Gwen, and thank you for the kind acknowledgement. Lions, with the support of Lions Clubs International Foundation, are working to reduce the prevalence of diabetes and improve the lives of those living with diabetes.
Again, our compliments, Dr. Rolly, and certainly for Club President Lion Caroline Lagasca, of course, our esteemed District Governor Cherry Meneses, and our distinguished council chairperson, Pons Yuson, a well-deserving congratulatory greeting in serving together for our Lions World Diabetes Events 2021. Sa kabila ng pandemya, tuloy-tuloy pa rin ang ating programa tungkol sa diabetes at senyales na din po nawa ito na tuloy-tuloy pa rin ang ating magiging Pasko. Salamat sa unti-unting pagbaba ng kaso ng COVID-19 sa Metro Manila at maraming lugar sa Pilipinas. Sana ganun din po sa mga kaso ng diabetes dito sa bansa. Doc?
May we start our webinar tonight, Lion Gwen, with an invocation to be led by the past president of Quezon City Cubao Lions Club, currently our Deputy District Global Leadership Team Coordinator. Fellow Lions, friends, ladies and gentlemen, please welcome on center screen, Lion Architect Ebenezer Madukdok. Lion Eben, please. Lion Pops, can you please unmute our past president?
Yeah,
Eben?
okay.
Okay. Go ahead, Lion Eben.
Okay. Lord, make me an instrument of your peace. Where there is hatred, let me sow love. Where there is injury, pardon. Where there is doubt, faith. Where there is despair, hope. Where there is darkness, light. And when there is sadness, joy. O Divine Master, grant that I may not so much seek to be consoled as to console, to be understood as to understand, and to be loved as to love. For it is in giving that we receive. It is in pardoning that we are pardoned. And it is in dying that we are born to eternal life. We glorify and thank you, our Father in heaven. We praise you because of your love and faithfulness to each and every one of us. Thank you, Lord, for the blessings of life and physical strength that we have now. In spite of the COVID-19 pandemic, we are here ready to serve our brothers and sisters. We thank our organization, the Lions Clubs International, District 301 Depot, our Quezon City Cubao Lions Club, who made this diabetes webinar possible. We seek your guidance and blessings to our event tonight, especially to our resource speakers. May their thoughts and words enlighten us and promote learning, especially to those who are challenged with diabetes. We entrust to you the rest of our day. All this we pray in the name of Jesus Christ our Lord, now and forevermore. Amen and amen.
Amen. Fellow Lions and friends, may we invite you to please rise for the singing of the Philippine National Anthem, to be followed by our Lions Prayer and the singing of the Philippine Lions Hymn.
Ang pambansang awit ng Pilipinas.
Kayang magiliw, kaya sa silanganan, alam ng puso, sa titik mo'y buhay. Lupang hinirang, kuya ka ng mahiting, sa mandulupin, di ka pasisingil, sa nagatang tutok sa simoy at sa langit mo pagkaw, ay hinatang tudlakawin sa pagkayang minamahal. Ang isang katawan mo'y tagumpay na nagtitindig,
when I attend my Lions Club and break bread at the table. I gave a million thanks to God to know that I am able to meet there with my fellow man. Relax, play and sing. To hear the speakers of the day, the fine thoughts that they bring. I realize that I have a part in caring for the blind, also the underprivileged. Let's keep them all in mind. Now as we do our daily tasks, pray God we do them greatly. Then liberty and intelligence will be our nation's safety.
Service to all mankind do we bring. To the lonely and the poor, give them love forevermore. We will fight to the last with all our might. Loud and clear our cry, we serve, we serve. Let our voices reach all nations far and wide. Caring love and sacrifice is our constant guiding light. Lionissimo, immortal pride. In the midst of the crowd, look for someone there who will touch your heart with his. Hear him not, shut him not, with an open heart. Lift him up, show the way, share in love. When the sunlight is gone and your day is through, take the smile and the joy that you sow. Lionism everywhere, roaring loud because we care. March along, sing along, get away. In the Lions Philippines, love and service to all mankind do we bring. To the lonely and the poor, give them love forevermore. We will fight to the last with all our might. Loud and clear our cry, we serve, we serve. Let our voices reach the nations far and wide. Sharing love and sacrifice is our constant guiding light. Lionissimo, immortal pride. Lionissimo, immortal pride.
Thank you very much to all of you. Please be seated as we request on the center screen to give her much anticipated welcome message, Quezon City Cubao Lions Club President, Lion Caroline Lagasca.
Beloved District 301 Dito Governor Rosario Meneses and District Cabinet members, esteemed Lion dignitaries, fellow Lions of multiple District 301 Philippines and from other areas, distinguished guests, our gracious resource speaker and member of the panel of reactors, dear friends. On behalf of the Quezon City Cubao Lions Club, allow me to greet each one of you a pleasant evening. Over the last 4 years, our club has chosen to accept the challenge of taking the lead not only in the community where we serve, but at the district level for diabetes awareness and action. It may not be an easy task, but we feel that it is in the particular global cause of Lions Club International that we can best serve, not only for the simple reason that numerous members of our club have relatives, loved ones, or who themselves are diabetic patients, but more importantly, we believe this is one global cause where our collective action as a club can result in the greatest impact to the communities that we serve. Last November 14, 2019, our club as lead organizer, District 301B2, along with District 301, 301A3, and District 301D1 together merged a feat that caught the attention of people around the world to the perils of diabetes through the largest human blue circle. Sadly, the mere calling of attention to diabetes is not enough, with the number of persons who have diabetes increasing by over 100 million between 2019 and 2020. And so this year, we decided that in addition to calling attention to diabetes, our club will help gather as many persons together through this webinar to respond to the World Diabetes Day with the theme Access to Diabetes Care. We hope to realize this in the person of our esteemed resource speaker and panel of reactors who shall provide a virtual information and consultation session. In addition to the webinar, we are overwhelmed to have been given the opportunity to assist in what we pray for can be a district-wide blood glucose screening program through the distribution of AquaCheck glucometers to each of the 52 Lions clubs of the district, which were donated by Roche Philippines. In this happy note, as president of the Quezon City Cubao Lions Club, I wish to welcome everyone to the 2021 World Diabetes Day webinar and to thank all of you for your participation. I pray that we will all greatly benefit from tonight's session. Thank you at magandang gabi.
Go, Line Gwen?
Doc, nakamute po yata kayo, Doc. Doc, nakamute po kayo. Hindi po namin
Okay. Thank you, Club President Lion Caroline Lagasca. Lions Club's International Global Service Framework Agenda is focused on 5 global causes: environment, vision, hunger, childhood cancer, and diabetes. To briefly share why Lions Clubs International in more than 210 countries advocates diabetes awareness and action. Let's hear it from our Lions Clubs International President, Lion Douglas X. Alexander.
Diabetes is a global epidemic that affects millions of men, women, and children around the world. But there is so much that we can do to help. That's why Lions are leading the fight against diabetes. Our programs are focused on promoting healthy lifestyles, and together we are reducing the prevalence of this disease through education and awareness, and improving the quality of life for people living with diabetes. Talk to your club about organizing a diabetes service project in your community. And visit lionsclubs.org/diabetes for our programs and the resources to help you get started. You can be the difference in diabetes for your community today, because changing the world always begins at home.
This year's World Diabetes Day event is graciously and generously supported by our event corporate sponsor, Roche Philippines, together with our support group and many media partners to be introduced later tonight in our press media hour.
Fellow Lions, friends, ladies and gentlemen, our pleasure and pride to introduce on center screen, please welcome our distinguished multiple District 301D2 Philippines District Governor Lion Rosario Raimundo Meneses, a progressive Melvin Jones Fellow.
Okay. So to our council chairperson, Pons Chuzon, Lion dignitaries joining our webinar tonight, officers and members of District 301D2 and other participating districts tonight, fellow Lions, ladies and gentlemen, good evening.
Evening, all.
Good evening. During the Lions luncheon with the esteemed Helen Keller nearly 100 years ago, we were challenged to become knights of the blind, to take care of those who cannot see and lead them towards the grand aspiration of life, despite their limited appreciation of the world. This challenge was then wholeheartedly taken by our organization to the point that our mission blossomed to several more endeavors that completes the global challenges which the Lions Clubs International adheres to this day. One of these challenges is our continued mission to let the world be aware of the effects of diabetes to our society and our communities. Diabetes is one of the world's deadliest diseases. There is no cure, and that diabetes, whose complications bring forth serious illnesses and even death, is always tied with a lifestyle and well-being. It is a disease that can be passed through the gene pool and can even distract the otherwise strong, healthy children, our youngsters. As a heredity disease, we are candidates, and sadly, we cannot cure it, but we can control it. Thus, the Lions champion awareness. Filipinos, as the world's most celebrated food and rice lovers, are susceptible to diabetes, which means that if we will not be careful, like a thief in the night, this disease can claim anyone, including ourselves. With this in mind, the Lions Clubs International and the district continues to be bringers of awareness and the torch bearers of understanding. This webinar is one of the myriad of different endeavors which the Lions Clubs International has been tirelessly organizing for the sake of diabetes awareness. Apart from the yearly donations, may it be in goods, services, and even funds, the Lions are present in all fronts, living the standards of Helen Keller's challenge to become knights, not more on the blind, but the rest of mankind. I would like to congratulate our district officers, especially District Chair Angelina Encarnacion and the Quezon City Cubao Lions Club, because their specialization on these kinds of undertakings transcend the convention and even the challenges brought about by this pandemic. It is my ardent desire that as we move forward, once again, opening our borders and our homes, we may continue what is left in the pre-pandemic world and bring it all out to perfection to the post-pandemic setting. There may be changes, but Lions is constant. It will never falter because our members shall always overcome all the challenges and claim aspirations for the betterment of the people, societies, communities, embracing the world. So sa lahat po ng narito at umattend at nakilahok, maraming salamat po. Mabuhay tayong lahat. We serve! Roar!
We serve!
Thank you very much, our District Governor Cherry Meneses. And now our much awaited part of this evening's program, we are fortunate to have with us again a sought-after medical expert in the field of diabetes. Our resource speaker in particular is an internal medicine endocrinology specialist representing the Philippine Center for Diabetes Education Foundation Incorporated, a member organization in the International Diabetes Federation. Allow me to give you his career highlights. His preparatory medicine as BS Biology is at De La Salle University, TAF. Medicine proper, Doctor of Medicine, De La Salle University Medical Center. Residency training, Internal Medicine, Makati Medical Center. Fellowship training, Endocrinology, Makati Medical Center. He is also the past president of Alliance of Clinical Endocrinologists, previously known as AACE Philippine Chapter. Past president and CEO of Southeast Asian Medical Center. Past president of Diacare Association of the Philippines, past administrator and program director of CAMPCO, CAMP Program for Type 1 Diabetes Mellitus Individual, co-coordinator for Diabetes Awareness, Week of the Philippine Center for Diabetes Education Foundation Incorporated, member of the Medical Bureau of Philippine Center for Diabetes Education Foundation Incorporated. Fellow Lion and friends, please welcome our resource speaker for tonight, Dr. Jose Carlos de Joey Miranda.
Good evening to everyone.
Good evening, Doc.
Good evening, and it's really my honor to share my thoughts and knowledge about the theme for this evening. Mainly because of for diabetes, and we know that it's really a global problem. And just to give you a brief background of myself, actually my dad was a Lions Club member for several years, and that was his first group that he joined as his role being in the civic community. So this is also in honor of my dad being a Lions member. Unfortunately, he passed away several years ago. So this is for him and for you and for everyone. So tonight, although the theme is about access to diabetes care, let me give you, of course, details about diabetes, because it's always important to know a lot of diabetes. And some of you may know this. Some of you this may be sort of a review. And some of you may be new to this. So it's important to know the numbers first. What's the problem? Let me lay down the problem of diabetes and how to manage it, how to manage diabetes. And later on, maybe we'll discuss about the access to diabetes care. So some of the subtitle of the things to know about diabetes, preventing type 2 diabetes, especially in this time of pandemic and beyond. Okay. So numbers. So let me lay down first the big problem of diabetes. So if we take a look at the Diabetes Atlas in the IDF, and this is 2019, and it's still the most recent data. If you take a look at this area, in the entire world, we have about 463 million as of 2019. But if you take a look at the increase by 2045, it's a staggering 51%. So malaki po. It's a big, big increase in the entire world. Now, if you take a look at the Western Pacific area, of which Philippines is a part, we have approximately about 163 million in the Western Pacific area. And there will be about 31% increase by the year 2045. So imagine how many people that will be seeing in our community with type 2 diabetes, type 1 diabetes. Now, being in the Western Pacific, these are the highlights that I can probably share about the diabetes. It's enough to say that in 1 out of 10 adults already have diabetes in our area. Okay, and a third of the total number of people with diabetes comes from our area, the Western Pacific area. How about our country? So where do we fall? Ito na. Where do we fall? We are among the top 5 countries for a number of people with diabetes in the range of 20 to 79 years old. So we have about 4 million people with diabetes as of 2019. And I'm sure by this year of 2021, it could have increased, especially if in these times of pandemic wherein the exercise, the lifestyle has been very, very poor. Okay. Now, accompanying the numbers of diabetes, we already know that's by the millions. How about mortality? That's the thing that we are afraid of. And that's the thing that we want to create awareness of in terms of diabetes. If you take a look at this age group of 50 and above until 70 to 79, this is where the large chunk of mortality of diabetes comes into play, both for genders, men and women. So as we get older, the chances of dying from diabetes and its complications becomes higher. And more so, this is another problem, not only for the country, but for the individual as well. The health expenditure goes up over the years. So from 2006, it's about, well, let's talk about US billions, about nearly a little above 200 billion, but now it's nearing already $800 billion in terms of expenditure for diabetes management. Now, what I was talking about earlier is about people with diabetes. How about people who are still undiagnosed with diabetes? Now, as I was telling you a while ago, we are in the Western Pacific area, and we are in our area is where it is estimated that we have a lot of proportion of people who are still undiagnosed. So that 4 million in the Philippines may perhaps be double or at least 0.5% increase. So that's about 3 to 4 million. 4 million, that's about 5 million, or even in fact 7 million. So that's how serious it is. So in order to understand and probably appreciate diabetes and its management, we have to know how it is defined. Okay, it's actually defined as a group of metabolic diseases, and the very common characteristic, or the common characteristic of diabetes mellitus, is hyperglycemia. So hyper means high. That's where it comes from. Glyce comes from sugar, that's glucose. And emia comes from the word hemia, which means blood. So that's high glucose in the blood. So that's what it means when we're talking about hyperglycemia. And what's the reason behind this high glucose in the blood? This may be defects in what we call how we produce insulin, or how the body reacts to the insulin that we are producing. That's what we call insulin sensitivity. Now, the name diabetes mellitus comes from the Greek term diabetes, which is siphon or to pass through. And mellitus comes from the Latin word, which means honey or sweet. So it started off wherein when one is passing through urine, it's a sweet type of urine. So that's where the diabetes mellitus word came about. Okay. So how does one develop diabetes? Now, actually, there are a lot of reasons now. We have about what we call an ominous octet. So the ominous means it's not a good sounding adjective, right? So it's an ominous 8 reasons why one may have diabetes. Just to name a few, you may have poor insulin secretion, you have insulin resistance, you may have problems with absorption in your glucose, reabsorption of glucose in your urine, you have problems with your fat, you have problems in neurotransmitter dysfunction where you eat a lot, unabated eating a lot. So these are 8 possible reasons why that may contribute to the high blood sugar of an individual. Okay. Now, how do we diagnose diabetes? How do we tell a person that one has diabetes? Okay. Of course, you need to check your fasting plasma glucose. If it's more than or equal to 126, then you might be defined as diabetes. If the test is that when they use a 2 hours after eating blood glucose, when you use an oral glucose tolerance test, if it's more than 200, then you may be categorized as diabetes. If your A1C, this is a blood test, which is a measure of your average blood sugar for the past 3 months. If it's more than or equal to 6.5, then you might need to consult your doctor and you might already be having diabetes. Or if on random blood sugar, meaning you just test your sugar at any time of the day, and you already have the classic symptoms of high blood sugar, and if it's more than 200, then you might be diagnosed as having diabetes. Now, keep in mind it's supposed to be not only one test. It requires 2 abnormal test results. Okay. Now, if one has diabetes mellitus, what are the different types? You might ask, what am I, doctor? Do I have this type of diabetes or that? You might consider as type 1. Type 1 is the ones that are happening in those people who are very young because their pancreas is not working anymore. There's an absolute lack of insulin production, which is supposed to be the hormone that controls the blood sugar of an individual. Type 2 diabetes are the ones that happen, commonly in adults, and they're the ones who may have relative or just not an absolute lack of insulin, but just a relative lack of insulin, or they are highly insulin resistant. You may have other forms of diabetes, and just to name a few, you may just have genetic defects of beta cell function. You may have disease of X-ring pancreas and the others. And the last form of diabetes is the one that happens during pregnancy. We call it gestational diabetes mellitus. So it occurs when an individual or a woman becomes pregnant and the sugar becomes high, then that individual may be categorized as gestational diabetes mellitus, which is a risk factor. Let me remind you, it's a risk factor for that individual to become diabetic, having diabetes in the future. Okay. Now, how do we know if one has diabetes? What are the signs and symptoms? So if you have a checklist at home, you might need to listen to this. You have what we call frequent urination. In the scientific language, we call it polyuria. You may have excessive thirst. In the scientific term, you may have polydipsia. Okay. You may have unexplained weight loss. You may have extreme hunger. In the scientific term, we call it polyphagia. Okay. Or some other symptoms such as sudden vision changes, tingling or numbness of the hands or feet, feeling of tiredness much of the time, or very dry skin. Now, sometimes we jokingly say this to the patient, baka member kayo ng PRAT. Okay, ano ba yung member ng PRAT? Prating gutom, yan yung extreme hunger. Prating uhaw, excessive thirst. Prating ihi ng ihi, yan yung frequent urination. So if you have those PRAT, then probably you might need to consult your doctor, and you may be having diabetes already. Now, the burden of diabetes comes into this thing, the major complications of diabetes. These are what we call the vascular diseases of diabetes. Now, these are categorized into 2. This is maybe the microvascular form, meaning the small blood vessels, and you may have the macrovascular forms, the large blood vessels. So the microvascular, you may have the eye problems that may lead to retinopathy, blindness. Kidney, we call that nephropathy, which may lead to dialysis or end-stage renal disease. Then you may have tingling sensation, numbness, cramps. You call that neuropathy. So these are the pathies, what you call the neuropathy, nephropathy, and retinopathy. On the other side, you have the macrovascular diseases. You may have the brain, the heart, and the extremities. Or this may be in the form of stroke. For the heart, it may be in the form of a heart attack. Or the extremities, you may have what we call peripheral vascular disease. When you see a person having already darkening of the skin of their lower extremities, they don't look very healthy, they are becoming dark or black even, then they may have already that severe peripheral arterial disease. Now, given that I've already laid down the facts and the realities and the details and the definition of diabetes, so how do we manage? That's the question. So let me give you just a layman's guide about diabetes management. So you yourselves, or we ourselves, can probably manage the one who are diabetes or people with diabetes, and probably this may also be a guide for them to prevent having diabetes, especially if they have a strong family history. Okay. So the basic principles are actually 5. Medical nutrition therapy. Keep in mind, I'm not calling it anymore diet. Medical nutrition therapy. Exercise. Education, which is what we are doing right now. Monitoring. And of course, medications. Okay. So let me go to medical nutrition therapy. The next slide that you will see is just the thing that you need to remember, whether you have diabetes or not. Okay. It's healthy eating. You may use what you call the plate method. Okay? The plate method requires us to, this is a 9-inch plate. Wag yung mga 15-inch plate. This is just a basic 9-inch plate. Half of your plate should be your non-starchy. These are fibrous vegetables. 1/4 of your plate should be your starch. So that may be in the form of rice, bread, noodles, root crops like your potatoes and sweet potatoes, or even your corn. All right. And the other 1/4 should be your lean protein. And in terms of ranking, your lean protein should be first your fish, followed by your chicken minus the skin. So that's your chicken breast. Third will be your pork without your fat, of course. And the last would be your beef, because that's where the hidden fat is. Now, how about fruit? Okay, fruit should be at least, if you all can do this, it's almost a measure of your fist. And those who have very large fists, it should be half of your fists. Okay, that's your fruit exchange per meal. Okay, now the option of milk and yogurt, it's there, but it's the best if you can just drink plain and simple water, healthy water. So with this, you won't get hungry. It's enough for your daily needs, and it's healthy. And it will prevent you from elevation of your blood sugar. How about exercise? Do all of us here do our exercise regimen every day? So the recommended is 150 minutes per week. And it is recommended that you combine your aerobic exercise. So it may be in the form of walking, jogging, dancing, swimming. Okay, you can use that. And you can use your resistance exercise. You may lift weights every other day. Okay, so aerobic activity may be 30 minutes extended. Gradually can increase it further to your 60 minutes per day, and most days of the week about 150 minutes per week. So how do you measure a good exercise? So what you can do is just measure your pulse before your exercise, and after your exercise it should increase about 60 to 7%. After an exercise, there should be an increase of your heart rate by about 60 to 7%. That will be your heart rate maximum target. Okay? And keep in mind that you should not exercise all of a sudden. You must include first a warm-up of 5 to 10 minutes and a cool down of 10 minutes to avoid any injury, to avoid any muscle cramps or strain. Okay? And as I said a while ago, exercise must involve most major muscles in the both lower and upper parts of the body. Education is equally important. That's what we are trying to learn now, and that's what we are trying to advocate in the Philippine Center for Diabetes Education Foundation. We have created the Diabetes Awareness Week campaign, which happens at the end of July, and that is a presidential decree that we celebrate Diabetes Awareness Week in the Philippines every last week of July. And I would like to invite the Lions Club to join us during that last week of July, aside from what we're celebrating right now, which is the World Diabetes Day. Monitoring. This is where the glucose monitoring comes into play. Now, you can buy or use your monitor to measure your sugar, especially in those days that one is very, very sick. Medications. So we have a lot of medications. The good thing about in our generation right now is that we have a lot of diabetes drugs that we have now. This may be in the form of the biguanides, we call metformin, your insulin, that the drugs that simulate insulin production. These are your sulfonylureas or meglitinides. You have your thiazolidinediones, your pioglitazoline, which sensitizes insulin uptake. You have your alpha-glucosidase inhibitors, acarbose or voglibose. You have your gliptins. You have your gliplozin, your SGLT2 inhibitors. These are the two new oral medications that are in the market. These are the new players. And you have also here your GLP-1 receptor agonist, your natides, dulaglutide and lixisenatides, example. Okay, and exenatide. And of course, we have your insulins, and we have the old and reliable human insulins and the new ones, your analog insulin, or these are the designer, what we call designer. We may call it a designer form of insulin because they have perfected the other human insulin that doesn't mimic the natural physiology. Okay. Now, in the American Diabetes Association guidelines, we are told, or it is recommended that when we approach a person with diabetes, it's not what we call a box type or by the book. Okay, it's not de cajon in Tagalog. Okay, we might have a more stringent goal, or we may have a less stringent goal, depending on the following factors. For example, if the disease duration is very, very new, then by all means, let's all be strict. If the disease duration is already long-standing and life expectancy is very, very short, our goal may not be too aggressive or too stringent, because the complications of overachieving or overtreating might be detrimental to the patient. So this slide is telling us now, in diabetes treatment, it is individualized, and each one has their own way of controlling and normalizing their blood glucose. So please don't what others are practicing. Sabi ng kapitbahay ko, bagay ako sa ganito. Sabi ni ganito, bagay ako sa ganito. Don't do that. You and your doctor are the ones who are best knowledgeable about yourself. Okay, in treating yourself. So the goals of care, according to the American Diabetes Association, is falling into this cycle. So if just in a nutshell, just to give you this summary, it involves both the patient and the doctor in achieving these goals of care. And what's the goal of care? What are the goals of care? To prevent complications and to optimize the quality of life. That is the main goal in diabetes treatment and even diabetes prevention. Okay. So recently we have experienced COVID-19 in these pandemic times. So how do we now relate COVID and diabetes? So the common question is, does having diabetes increase really the risk of getting infected with COVID-19? The actual answer is not really. Anyone can get the COVID whether you have diabetes or not. But the problem is, if one has diabetes and that person acquires COVID, then they may have the worst complications of COVID, okay? Because their immunity is quite low and they have more complications already present in their system. And available data suggests that age is associated with worse outcomes with COVID-19, okay? And can be now hypothesized that this relationship is stronger in people with diabetes for at least three reasons. One, we know that the prevalence, as I have shown a while ago in that slide, that the prevalence of diabetes increases with age to reach a peak at people older than 65. And people more than 65 years of age are more likely to have a longer duration of diabetes and a greater prevalence of diabetes complications. Okay, and we all know that diabetes and old age correlate with a lot of other conditions such as heart disease, hypertension, stroke, obesity, and the like. Okay. And this is just to reiterate that in patients with COVID-19, those with diabetes are more commonly had other diseases, and they make the hospital the prognosis quite poor. So prevention is the key. So how do we prevent? We just go back to the basic principles. If we are strict with our body, if we are strict with our healthy lifestyle, then we can prevent us from having this disease and its complications. So how do we now, in terms of COVID and diabetes, just to remind that take medications consistently as prescribed and keep enough on hand. Importante po yun. Ensure you have enough supply of medications and equipment, be it in the form of your monitoring, your insulin, your tablets, okay? Now, we already have delivery systems in terms of those people who are frail and elderly with limited mobility, they can be delivered these medications. Now, when do we need to seek medical attention? First, if you are doubt of anything, you seek consult to a doctor. If one is vomiting repeatedly, and then probably having this problem already with ketoacidosis, make sure you consult your doctor. If the blood glucose is very high for more than 24 hours, consult your doctor. And if you develop what you call ketoacidotic symptoms, which may be in the form of vomiting, rapid breathing, abdominal pain, and there's drowsiness, then the one individual might be having the complications of very high sustained blood glucose, which can be leading already to ketoacidosis. Okay. Now, if one is sick, what are the rules? What are the things to do if one becomes sick, especially if one has diabetes? And I guess this may be applicable if one already has some just metabolic syndrome. Make sure to take your medications, okay? Test your blood sugar. Drink more fluids. Make sure it's caloric-free. It's not supposed to be juice or soft drinks. It should be caloric-free drinks. Weigh yourself every day. Losing weight might be a sign of very high sugar, even if you're eating normally. Check the temperature. Maybe your fever is already there, and it may be a sign of infection. Okay. Liquids is about 120 to 180 ml every half hour to prevent dehydration. So these are just sick day rules and guidelines, especially if one has this illness we call diabetes. Okay. And it's also important to stay in touch with persons who care about you. Don't keep this all to yourself, especially these times of pandemic. There's chatting, there's what you call calling, there's video call. It's important. Take breaks. Make sure to unwind. Don't be a monotonous individual. You can go outside, breathe the air, just outside of your house and probably to the park and exercise. Okay, just make sure there's distancing, proper distancing. Take deep breaths. And usually do the activities that you usually enjoy. And probably even try new activities, try new habits, try new something like a hobby. Okay, and of course avoid these alcoholic beverages and harmful habits such as smoking. Okay. Okay. So to remind everyone, in these challenging times, keep physically healthy. You do your physical activity, exercise, and nutrition. Stay mentally resilient. Discuss your sick day rules with your doctor. You might need to monitor your sugar very frequently. And you have to remind yourself when to seek medical attention. We don't be late in seeking your medical attention. Okay. So in the management of diabetes in these times of pandemic, keep these things in mind. A healthy lifestyle, okay? Medical nutrition and exercise, enough sleep, no smoking, avoid too much drinking, okay? Or in fact, don't drink alcohol. Take medications regularly, all of your medications, whether it's for diabetes or not. Achieve normal blood glucose levels, not only blood glucose, but also blood pressure, blood lipids, all the other measurements that needed to be done. Make sure it is in the normal level. Have your checkups regularly, be it in the form of your face-to-face or a virtual checkup. There should be good hygiene. In these times of pandemic, of course, observe physical distancing, wear proper protection, face mask, or if you still want, face shield, especially in these crowded or enclosed areas. Okay. Now, the access to our diabetes care, we have a lot right now. We have your virtual clinics, we have face-to-face. Now, we have what we call diabetes clinic, diabetes education clinic, and this can be accessed in the different hospitals And this is where the Philippine Diabetes Center for Diabetes Education has been doing, because they are training diabetes educators every year, and they're putting into the different parts of the country, and these are being set up in the different hospitals. Okay. Access to diabetes care, we also have your diabetes clubs. There are members of what you call diabetes clubs, which can help each and people with diabetes cope up with their problems. For type 1 diabetes in the Philippine Center for Diabetes Education, we have what we call the Camp Cope program. The Camp Cope program, which I was involved in for the past years, involves children with diabetes who have problems in coping up with their disease. And they usually have a 4-day camp wherein they are taught about independently taking care of themselves and also knowing when to seek consult with their doctor. And usually it is a very successful program that when they go home, the parents become very proud of their kids being independent of their illness and very aware of what's happening. Okay. And other things when you're talking about access to diabetes care is that we also have in their different pharmaceutical companies, they have their we call nurse educator and diabetes educator. And you can ask this to the doctors, because they know these people can give time for you through call, virtual, be it virtual or face-to-face in supporting their diabetes management. And lastly, since I'm talking in behalf of the Philippine Center for Diabetes Education Foundation, the foundation has been established by Dr. Tonwa for the past years already, for decades already, and we have been having programs of Camp Cope, programs for Diabetes Awareness Week, which I've said a while ago, which is celebrated at the last week of July, which was a presidential decree by former President Fidel Ramos. And we are already also having educational training for diabetes educators, of which they have an annual convention every month of November. So with that, I hope this was a short but meaningful and sweet lecture for everyone to know when talking about diabetes management in these times of pandemic. And I'm sharing a little bit with about the access to diabetes care. Now, lastly, if you notice, I was never mentioning the word diabetic. It is now, let's try to avoid the term diabetic because it's not a good adjective for people with diabetes. The better term that we are advocating now is to give the term people with diabetes, not diabetic individuals, because it has a negative connotation. So with that, I would like to thank you for your attention, and I would be glad to answer any questions that you may have. Thank you very much for your attention.
Thank you very much, Dr. Joey. Sorry, out of script ako mga boss. A few hello muna para lang baka hindi ko na ma-helloan mamaya. Of course, I would like to just acknowledge the presence of our beloved GAT Area 5 leader, Lion George Ong Tan. Good evening, Chairman. Also, kanina baka lang naputol. I was overwhelmed. I'm seeing it. I saw our Council of Governors Chairman Pons Yuson was here a while ago. Baka lang naputol siya. And of course, pasalamat lang din doon sa mga taga Iloilo. Maayong buntag sa inyo. At maayong gabi pala. Sorry. Tapos meron ding mga taga Cebu, sina Lion Esther. And of course, mga boss namin dito sa district namin, nandito yung mga presidents, saka yung mga dignitaries namin. Pero meron ding nakita ko ang galing pa sa sa C. Tama ba? C ba yung nasa Pangasinan? May nakita ko. Pasensya na ho kayo kung hindi ho ito yung venue siguro para mag-isa-isa kasi kulang na alam ko gabi na. So we will go back to the program. Lion Doc Rolly, Lion Gwen, take it away. Sorry for my pakikialam sa inyong programa.
Thank you, Lion Pops, fellow Lions and guests, for and in behalf of Quezon City Lions Club, District 301 D2, our multiple District 301 Philippines, Lion leader, dignitaries, our corporate sponsor, Roche Philippines, and our media partners, we wish to convey our sincere thanks and appreciation to our resource speaker, Dr. Joy Miranda. Fellow Lions and guests, a warm of applause please again for our resource speaker, Dr. Joey Miranda.
Thank you, po.
Lion Gwen, please proceed.
We now proceed promptly to our press media hour. May we invite on center screen online our panel of reactors to answer questions together with Dr. Miranda, our key resource speaker from the various media outfits and organizations present with us tonight. To join Dr. Miranda, please welcome our fellow Lion, also popularly known as a spokesperson of the Philippine General Hospital. We take pleasure to introduce to you past Region Chairperson, District Chair, Dr. Jonas Del Rosario, with architect Cynthia Clement Udons from the Philippine Diabetes Support and Awareness Group, Incorporated.
Good evening to our panelists reactors, Dr. Jonas and architect Cynthia Clement Udons. May we now hear the questions from the press. And before we do that, partner Lion Gwen, can we acknowledge the many different media outfits that have supported our World Diabetes Day observance? Go ahead, please. Can we identify and read the names of our media partners? Partner?
Yes, Doc, now we acknowledge with much thanks and appreciation our supporting groups and organizations, Roche Philippines, A Smile from Heaven Foundation, Philippine Diabetes Support and Awareness Group, Incorporated. We would like to also thank our media partners in this advocacy. Thank you so much for having us in your show, Healthy Chat at Sunshine, hosted by Meth Sanding Minon, last Monday, November 8, over DZAR 1026.
Homebody, hosted by Miss Jamie Quinto. Last Wednesday, we were their guests over DZME, 1530 kilohertz on AM station.
Trending Ngayon, hosted by Miss Judith Estrada Larillo, last Thursday, November 11, over DWIZ 882.
And personally, I had the fortunate opportunity to be the guest at Beat Watcher, hosted by our friend Mr. Romy Tuason, over broadcast streamcast communicators.
Our media outfits, banner media columnist Mr. Danilo Garcia,
Business Mirror broadsheet,
CNN Headline News,
Herald News Update, and with correspondent Miss Pao de la Cruz.
Largo Weekly Paper, Lion Sonny Kalapit of Makati Platinum Lions Club, District 30182.
Mabuhay PH Digital Network, correspondent Miss Ned Muescan.
News on Sea, correspondent Sir Peter Paul Salas.
NGO TV Network, correspondents Ms. Isabel Fern.
Philippine Graphic Magazine.
Philippines Headlines News Expose, correspondent Lion Roslyn Di Maisip of Taguig Global Centennial Lions Club.
Filipino Mirror, correspondent Mr. Chris Galit.
And of course, Lions on Air Facebook page, our very own Lion Gia Benaventura. Partner, on this side, we like to express that our webinar for the World Diabetes Day this evening is in loving memory of our first Vice District Governor, the late Lion Tomas Gualberto Meneses. Likewise to another diabetes patient before he passed on, the better half of Lion Gia Benaventura, no other than Lion Dan Villarba Benaventura. And today, we lay to rest one of the pillars of Quezon City Cubao Lions Club, past President Lion Rogelio Bawayan. So we lovingly dedicate this webinar tonight for our fellow Lions who passed on, but their memories will live longer in memory and in our hearts. Partner, may we now hear the first question from our media partners. can you please state your name and the media organization you are representing, and to whom in particular you would like to ask question from our resource speaker and our medical panelists and panelist reactors. Lion Gwen, can you see any question online or at the chat box? If they would like to go and ask question live on air, we will unmute them, Lion Pops.
Go ahead, go ahead. Please raise your hand and so we could unmute.
While waiting for a question from Lion Gwen and Lion Pops, we would like to say thank you to all the 52 clubs who have supported our World Diabetes Day event today, November 14, 2021. And we will be continuing our diabetes surveillance and action for the rest of this Lion year. So
I have one question from the chat box.
Okay.
It's from Lion Louis, RC Louis Encarnacion. Dr. Joey, what are some of the common misconceptions about diabetes?
Okay.
This is from Dr. Dr. Jonah.
Okay. So one misconception that I'm usually asked about mga patients is they always ask the question, Doc, mawawala ba yung diabetes ko?
Okay.
Yeah. Diabetes, will it be gone? Okay. So to answer that question, it may be not good kasi nga, once you are a diabetic, once you have diabetes rather, it's there for life. Okay. There is no data yet that will tell us that it can be reversed. It can be controlled, but it cannot be reversed. Probably the other question that we can ask this is, Doc, can I prevent myself to have diabetes if I have a strong family history? If you are not yet diagnosed, then the answer is a big, big yes. Even if you have a strong family history, if you achieve or practice a healthy lifestyle, then by all means, you can prevent one from having diabetes in the future. But if you have diabetes already, you cannot already reverse it. The best thing that we can, as of the moment, we don't have any data yet that it can be reversed by any other means, but we can control it by a lot of means. Okay. Now, other things is usually the things about diabetes that are being asked is about supplements. Okay, misconception about supplements. Now, there are supplements as of the moment that are being advocated for diabetes management. Now, the answer to that question is not until we have evidence. And evidence has a very different categories, a level of evidence, and it should be a high level of evidence, and it should be consistent before we can say that supplements or herbals can be being used as treatment for diabetes. As of now, since there are no therapeutic claims approved, we cannot say that it is a medication for diabetes. Now, other misconception about diabetes in terms of management, about certain drugs for diabetes that can probably harm. Now, diabetes drugs, just to let everyone know, these are studied for several decades already. And let me just give you one example that is now being subject to controversy, which is the metformin in the Facebook. A lot of patients are telling us, Doctor, is metformin really dangerous? Some say that it damages the kidney. Some say that it can cause cancer. Some say that it is already a drug that is put out in the market. That is not true. If you take a look at the different diabetes guidelines, the number one drug that is being advocated there is metformin. Why? It's nearly 75 years already in the market. And it is considered as a very safe, and the thing here, it's a very cheap drug, and it is readily available in the market. Now, the story behind the kidney problem for metformin is that when metformin is being used in an individual, the creatinine is always normal. Now, when the creatinine becomes abnormal, this is where metformin is not anymore advocated because it can further damage the kidney. So that was misinterpreted as metformin being the culprit in the kidney damage of the kidney, but it's not. What is damaging to the kidney would be the uncontrolled blood sugar, the uncontrolled blood pressure, the unabated poor diet, which is high salt intake and high protein diet and lack of exercise. So these are just some of the recent misconception about diabetes and its management, just to answer a few.
Doctor, ako, pwedeng sumingit mo na ako, Rol?
Yes, yes.
Doctor, meron kasing, actually, tanong din ni Dr. Jonas and I would like to really ask this question. Kasi nangyayari yung iba, nabigyan ng metformin. Akala, ginawa nila, ay, takot sila sa metformin for those reasons that you mentioned, hindi sila iinom ng metformin. Pero sabi naman nila, babaguhin ko diet ko, di ba, Doc Jonas? Tapos mag-exercise ako. Does it work or do you, and further question, is metformin ever or being prescribed kung hindi ka pa diabetic?
Okay. There was a study we call Diabetes Prevention Program wherein it was studied to see if it can prevent diabetes. Okay. Now, there were three groups. One is just the standard group. The second one was the one given metformin. The third one was the one given where they were advised to do a lot of physical activity, healthy lifestyle. The one who gave the most successful diabetes prevention was the one with a very good lifestyle therapy. Okay? Metformin was also able to prevent diabetes. Okay? It was able to do so. But since lifestyle therapy was more successful, it was not really that given much media attention. But if there's a drug, if you were to ask me, okay, what's the best way to prevent diabetes? Of course, is lifestyle intervention.
Okay.
But if you were to ask me, is there a drug that can probably also prevent diabetes? Then we have, based on a study, which is Diabetes Prevention Program, metformin. It's safe and it's not dangerous.
So, dapat pala itanong mo sa Dr. Doc, pwede ba akong tumigil ng metformin later? O
well, if you
na yung sinasabi mong forever.
Well, if you have diabetes, as I've said, that's why I gave the lecture about definition of having diabetes. Because if you already have one, then you need treatment. Now, there will come a time that you were diagnosed to have diabetes and you were given treatment. That's biglang normal. Okay. Now, to that point that it may reach to a point that you may be able to remove the drug. Now, you might misunderstand it as I was already able to prevent diabetes. That may be what we call just a honeymoon. We call it a honeymoon period. Okay? It's only a temporary kaligayahan. Okay? Basta panampanang kaligaya, it was a temporary happy period, but eventually there was improvement probably because the reason behind that, just to give you a layman's perspective, there was an improvement of blood sugar, so the less exposure of your pancreas to sugar. So there was less what we call glucose toxicity to the pancreas, and the pancreas was able to somehow, so some individuals, this is not to everyone, I'm just stating that fact, somehow able to recover. Okay, recover in some way, but that recovery may only be temporary. Okay, that's what we call a honeymoon period, and it's very common in type 1 diabetes who were given insulin. They were able to do very, very well to the point that insulin was lost for quite some time. Then they were able to, that sugar bounced back. Okay, so to say na, kaya nga I was saying, not until we see that people with diabetes per se has a study that is a drug that prevents it, then we cannot. Right? So,
thank you, Dr. Joey. There's a question here from a good friend of mine, one of the editors of Philippine Star.
Yeah.
Directed to Dr. Jonas Del Rosario. Good evening, Dr. Jonas. As a cardiologist, my good friend here has a son who is a juvenile diabetic. So, how does a juvenile with juvenile or a child with diabetes is affected with the possibility of any cardiovascular disease at an early age? Dr. Jonah. Pops, you have a mic for Dr. Jonah.
Okay. Hi. Thank you. Good evening. Thank you for
Doc.
that question. Yeah, as a pediatric cardiologist, just as a backgrounder, we're seeing younger and younger patients who are obese, and some of them have hypertension, and even some of them have high blood sugar to a point that they are diagnosed. No. On the other hand, the one that you asked, yung juvenile diabetes, that's something that is from the very beginning. They were in a way born with had insulin dependent, no. So I have seen these patients develop earlier onset of hypertension. Their hearts are bigger in some of our patients. So in fact, in PGH, while it's it's a COVID referral center, a lot of the sicker COVID children are obese. Some of them have diabetes. So clearly, not only in the elderly that diabetes was a risk factor for having severe COVID, but even in children. No. So the short answer to that is yes. If you have insulin-dependent diabetes, which we call juvenile diabetes, you really have to be very careful in maintaining blood sugar control because you got it early, and so as expected, you might have the complications much earlier.
Thank you, Doc Jonas. The next question is posed to Architect Cynthia, more likely by a fellow Lion of member of our Lions Club. Architect Cynthia, we are on the forefront of diabetes awareness and education. Can you give us more information on how our Lions Clubs can be working closely with your organization, Architect?
Architect, bago ka sumagot, may follow-up ako dyan, ha? Sige, thank you.
Architect, good evening.
Hello, hi, good evening. Our group has been created. It's for the reason that it's really hard to find education about diabetes. We can find some, but it is outside the country. So when they talk about different kinds of food, we don't have it here. The founder decided to start the group, and that was 2017. And now we are 23,000 members, all Filipinos. And most of the things that we need are education, of course, because there are really lots of misconceptions, like what Doc Joey said. Metformin can damage the kidney. Actually, meron pa ng fad diets, like keto or LCIF. That's intermittent fasting. Marami, and then this herbal like insulin plant. There are lots of members that cannot afford to sustain their diabetes cases, different cases. So, yun ang aming tinatry na mabigyan ng advice. Meron namang mga members din na may alam dito na free consultation. Ipapaalam agad sa mga members. Yung mga like assistance like from DSWD, yung mga advice, ganun kami magtulungan. So, meron pa nga minsan na walang pambili. May nagdo-donate ng pera. Kahit pa paano, marami, lalo na sa probinsya. wala na nga pambili. Pag may pera naman, hindi available yung gamot.
Thank you, Architect. The question probably was asked by Lion because part of our diabetes awareness program is creating diabetes people with diabetes field group. So probably your organization can be of help probably with other Lions clubs who may be conducting diabetes, people with diabetes field group that would be educating and helping them manage their diabetes. Thank you.
Doc Rolly, singit lang ako kay Architect Cynthia. Architect Cynthia, pasensya ka na, anak ko yung nagtanong nanonood. Ganito ang sinatanong niya, paano raw ba? Kasi alam mo, kapangpangan yung mother Paano ba daw gagawin nilang pagkain na hindi nila aalisin nila yung kanin? Kasi pag nakakita ka ng kapangpangan, isang kalderong kanin, kahit isang kutsarita lang na ulam, okay na. Pero how do you correct this? Is there a way? Siguro Doc Joey at Doc Jonas, tumulong kayo. Kasi palagay ko, isa sa pinakamalaking issue yung pagkain nga ng Pilipino ng kanin na sobra
That's true. Maraming namumroblema na members namin dahil sa kanin. Hindi naman kailangan totally zero there are different kinds of rice. May brown rice, black rice, red rice, adlay, no? And right now, ako ang ginagamit ko ay Slimmers because they have ang hanapin lang is the low GI. At least medyo mabagal ang yung metabolize sa katawan, hindi siya nag-spike agad. And then of course, yun nga, kalahating cup, and then pagka talagang kapos pa rin, daanin sa gulay, green leafy vegetables. Wag sa karne
Okay, thank you. Maybe Doc Joey and Doc Jonas would like to say something about that question as well.
Okay. The reason, maganda nga ho yung tanong na yun kasi nga we are all, pag fiesta na lang, obvious yung kinakain natin. Sobrang, parang namumundok po yung pansit at kanin, So, alam nyo, kaya nga ho we're trying to create this awareness para po mabago yung ating habits. Now, there are what we call free foods. Pwede naman po kayong magsingkamas, magpipino. These are fillers which are non-caloric. Okay? Now, recently, of course, this is not yet being advocated. But recently, meron din po tayong tinatawag on how to eat your food in terms of how to eat it in ranking. So, the recommended is unahin muna po yung vegetables. Second, yung ulam. Tapos mabubusog ka na, huhulihin mo na yung kanin. Okay? Mahuhuli po yon. So that may be one way of somehow revising or probably yung baguhin po yung habits natin. So that's what, dyan fund ang Japanese, diba? Nauuna mo yung other things before they end up with rice. Or even Chinese, diba? Sa laureate, nasa huli yung kanin. Napansin nyo pa naglo-laureate kayo. Pagdating na nung kanin at tinapay, busog na ako, hindi na ako kakain. That's one way. That's one simple way of practicing avoiding these carbohydrates. You put it in the last part. Now, if you notice, kulang ba yun? Yung half of the plate is green leafy vegetables, 1/4. Actually, it's not. If you take a look at this caloric value, the computation, that's enough. The only difference probably, siguro kung kayo po ay nag-construction worker, o kaya yung nagbubuhat ng kung ano-ano of which the caloric requirement is really very, very high. Probably that's the time you might need a little more than the usual. And in the management of diabetes, hindi naman po namin sinasabing almusal, tanghalian, hapunan lang. Meron din pong tinatawag na merienda. Okay? No, pwede naman kayong mag-light snack po sa umaga, may light snack sa hapon, para hindi naman po kayo parang pagdating ng sobrang gutom. You can do that naman po. Sometimes ako nagre-recommend ako ng isang maliit na yung mais puti o kaya pansit sotanghon, wag kanton yung mga pansit sotanghon or beyond very light or crackers lang or wheat bread na tuna yung palaman po. Pwede po yun. That can also be a filler and high in fiber. na kakainin. Now, pagdating po doon sa kanin, kahit naman po yan brown rice, pero kung 2 cups of brown rice, baka pareho rin po ang calorie content. Baka you might misinterpret it po na pwedeng porke brown rice, kaya po yan pwedeng marami. Now, the story behind brown rice, dapat nga hindi bahal yan kasi ang brown rice, the story behind that is dapat po yung pong hindi unrefined rice po ang tawag doon Yung kasama pa yung sapal. So kung ma-advocate po sana sa Lions na yung mag-produce tayo po ng palay na unrefined, yun po ang totoong brown rice na may nakakabit pa na mas mura kaysa hindi naman po kailangang organic na organic. Basta unrefined rice would be good enough to serve as your brown rice. That's actually the story behind it. Pinaganda lang yung kulay. But it's actually unrefined po yun. Kasi nandun pa po yung fiber.
Thank you, Doc Joey.
Doc Rolly, yung kay Dong, Cab Tres Dong.
Lion Gwen, can you read some questions online, please?
Yes po. So to our experts, we have a question from our immediate past district governor region Abuel. Ang sabi niya po, since you said that metformin is good, which daw po is better? Metformin or insulin? And kung may side effect daw po ba ang insulin? Or can you compare the two po?
Okay. Pareho po siyang magaling. Okay? Insulin is an injectable form. That's why the acceptability of it medyo mababa kasi injection But in fact, it's a very powerful drug. Yun ang walang limit pag sinabing lakas yung potency ng pagpapababa ng sugar. Walang kalimit-limit ang insulin. It's just that it's injectable, and since it's injectable and it's fast, some of them are fast and long-acting, you need to monitor your sugar, and this is where glucose meters comes into play. Metformin, on the other hand, it's an oral drug kasi kaya more acceptable siya. So if the doctor deems it necessary na your sugars are very, very high, A1C very high, then we need to bring it down the soonest possible time, then insulin will come into play. Now, if your sugars are not really that elevated, okay, at kaya naman type 2 diabetes, may type 2 ang diabetes mo, then metformin can come into play as long as there's no contraindication. What are the contraindications to metformin? Yun nga, kung mataas na yung creatinine, bawal po. At saka yung mga GI side effects na yung mga sensitive ang tiyan kasi ang side effect ng metformin is it can cause parang nausea, parang nag-LBM lang po, at yung parang mahangin, yun lang naman. Now, can it be combined? The answer is a big yes. You can combine insulin and metformin.
Okay. Doc Joey, one of our media practitioner, Romy Tuason, is going to ask a question. Come in, Sir Romy Tuason, go ahead. Bobs, can you please unmute Sir Romy Tuason from SmartCard Broadcast? Sir Romy Tuason, he has been raising his hand since earlier. Sir Romy, can you ask? Okay, go ahead, Sir Romy. Thank you.
Kay Doc Joey, Doc Joey Miranda.
Apo.
Doc, kasi we're talking about metformin. I'm too is a person with diabetes. Some doctors told us, for me particular, he said if the doctor what do you call that? Nagreseta sa iyo ng metformin, sabi niya, change your doctor. Paano niyo masasabi ang ganun?
Okay, ganito po 'yon. What you gusto ko lang po bigyan ng respeto yung ibang doktor about their own opinion. Okay? I won't say anything about to my colleagues because they have their own opinions, but nowadays po, 'di ba, we need evidence to back up what we are saying. And this metformin is backed up by evidence po. And one best thing to do is just to take a look at the different guidelines. Number one, American Diabetes Association guidelines, AAC, American Association of Clinical Endocrinologists. Yung ating Philippines po, meron po. Yung pong Canadian guidelines, Indonesian, ASEAN Federation, all of these guidelines, or even IDF, yung International Diabetes Federation Federation na nagsasabi po na ang first line of treatment for diabetes is metformin. Kaya nga ako sinabi ko yung kanina about controversy kasi nga malaking controversy po ang metformin dahil po sa pinalalabas po sa Facebook, which is unfounded. That's why I'm giving the history kung bakit po naging ganun ang komentaryo about metformin na sinabi na kidneys po. Yes, totoo yun. Kung mahina na po ang creatinine, bawal na siya. Sa healthy kidney, pwede po siya. Okay? Nakaka-cancer po siya? Hindi po. Now, actually, may mga studies po, nag-lecture po ako about metformin na meron siyang anti-cancer properties. Although, hindi pa ho yan ina-advocate. Pero merong pag-aaral na meron po siyang anti-cancer. Now, there was a pull out of metformin and even losartan yun a few months or years ago. The reason behind it is because of the impurities of the manufacturer, but not the metformin per se. Yun po. Kaya nami-misinterpret po yan because of what they read in the news is not yet the complete story. So may mga kwento po yun. Ipapayagan po ba ng FDA ng Pilipinas pumasok yun kung yan po nakakamatay? Siyempre, nasa responsibilidad po yan, di ba? So kung rin po, responsibilidad po namin na malaman ng kwento behind it if we were to prescribe it or not. Now, we all have our own opinions, but our opinion is based on evidence.
Dr. Joey, we have a question from my best friend, our cabinet treasurer, Lion Dong Lunario. Dr. Joey, what is the best milk options for people with diabetes?
Best, ano po? Meal?
Milk.
Gatas. Milk.
Gatas.
Milk. Okay. Now, milk po, in general, also has caloric value. Meron po yan. Lalo na po yung mahilig buminom ng full cream. Okay. Diba? May brand na full cream milk. Naku, mataas po ang caloric value niyan. Mataas po ang fat content. Now, for women or for us, for those who are in the postmenopausal, di ba, ina-advocate po natin ay yung high calcium non-fat milk na pwede naman po. But there are other milk or milk-like, ang tawag po namin doon, milk-like substitutions. Yan po papasok yung mga tinatawag na brands na, if you may have heard of this, na yung Diabetasol, Glucerna SR, Nutren Diabetes, Glucobest. These are nutritional formulas that are low in glycemic index and low in does not contribute to the elevation of sugar immediately. But baka po magkamali kayo, no? Hindi po to gamot. These are nutritional replacements. Okay? Yung iba ang ginagawa po, kaya po nagkakamali, kakain ng full meal tapos may kasamang isang basong ganon. Kung pag-aaralin niyo po, yung additional calories po yun. Okay? These are designed for meal replacement. So doon po sa mga medyo mabigat po dyan at gusto pong magpapayat, gusto nyo yung dinner nyo po, imbis na yung ordinary dinner, ipalit nyo na lang po ng isang meal replacement formula, lalo na po kung may diabetes po kayo, tulad ng mga sinabi ko. Ganon po yun. Now this, may pagkakaiba lang po sila sa certain formulas, but they are nearly the same. Yung mga ganyan pong mga milk-like, or we call it nutrition formulas po, na preferably for people with diabetes.
Doc Rolly, singit lang ako bago ang lahat. Narinig ko kasi yung sinabi ni Doc Joey. Mamaya ako, may mga fortunate sa inyo, makakakuha ng Diabetesol, care of our beloved Area 5 leader, George Ongtan and Lady Rose. Namigay ho sila na isang case. Pamimigay ho namin. Nung nakita ko yung presyo, kinabahan ako na parang gusto ko ibalik. Nahiya ako. Mahal pala yun.
Mahal po. Mahal po.
Thank you, Alan Pops. Doc Joey, our next question is one from, batiin po muna namin. The next question comes from the awardee ng Dangal ng Bayan Award for Outstanding Public Official, no other than our fellow Lion and reactor panelist, Dr. Jonas De Rosario. Doc, ito po ang katanungan. Doc Joey, kapag mahilig ka ba sa matamis, magkaka-diabetes ka kahit walang family history. Can you comment also on the observation that simple sugars or carbohydrates now are more problematic than fats in cardiovascular disease or diabetes?
Teka, yung una muna pong tanong, yung kung wala po kayong family history ng diabetes at kayo po ay mahilig sa matamis, pwede ho ba? Well, yan po ay kung ang inyo pong, yan po ay ang tanong po dyan is ganong katagal ba at ganong karami ba? Kung if this will lead to what we call obesity because of eating too much sweets. And we know that obesity is a risk factor to become having diabetes. Then the answer is probably yes. Okay. It may lead to what we call a condition. Again, I would repeat, eating too much, sabi nga nila, if there is an excess of a lot of things or there's an excess of things, it has a consequence. And the consequence may be obesity, and that obesity may lead to insulin resistance, which eventually in the years to come, pwede ngang maging may magkaroon ng diabetes. Kaya di ba may mga tao po na, Dok, nag-diabetes na po yung nalolo ko ng mga 70 years old eh. Ganyan ganon, di ba? May mga tao pong ganon. It may be po, kasi yung genetic factor po, it's not tapat na 100%, but it's a very high risk factor. Okay? Pwede po sila mag-deal to what we calling metabolic syndrome. And metabolic syndrome is a condition which leads to, is a prelude po yun. It's a prelude to diabetes. Nasama dyan ng obesity, mataas ang triglycerides, mababa ang good cholesterol, tumataas ang blood pressure. So,
Doc, yung second question, yung follow-up ni Doc Jonas, yung observation that simple sugar or carbohydrates now are more problematic than fats in cardiovascular disease and diabetes.
Sa tingin ko po, that's part, kasama na po yun. Kasi napansin nyo po, if one has having diabetes, very near po yung tinatawag na yung cardiovascular diseases, macro and microvascular. Kasi isa ho sa mga, yung tinatawag nating pathophysiologic mechanism, meron po tayong glycation end products na kasama po dyan yung ating vasculature. Tapos may medyo complicated. May sorbitol pathway, may PKC pathway, marami pong pathway yan kung saan ang contribution ng hyperglycemia nandun po na nagdudulot po ng both micro and macrovascular diseases. Now, kapag po mataas na ang sugar at may obesity, ay babalik na naman tayo. Pag mataas yung mga simple carbohydrates na yan, pag sobrahan po yan, again, it may also lead again to obesity, which again leads to more fat, more fatty acids na tinatawag that will be released that can contribute to the cardiovascular disease of an individual.
Next question po, Doc, from Lion Root David. If mahilig ka lang sa kanin, dapat lang bang i-burn through exercise?
Well, mababurn po yan, pero depende po kung ganong karaming kanin ang kinakain nyo. Baka naman 3 cups of rice yan. Ang hirap po i-burn ang 3 cups of rice. Alam nyo po, baka sometimes we don't know how much exercise we really need to do to burn, for example, kunyari, isang brownie, chocolate brownie. Parang, if I can remember, you need to exercise 2 hours po just to burn that amount. Just one small brownie, ganun po yun. And if your calories are very high, the amount of rice that you're taking is too high, then you need to burn it more by doing exercise more. If you have all the time, by all means, yes. But keep in mind, exercising too much may also be detrimental to the health. You may have heart disease, you have fatigue of your muscles, you may have arrhythmia, di ba? Yung mga too much doing exercise, they can have problems with their heart as well. So, wag naman pong ganon. Wag na pong gawing in order for me to enjoy rice exercise. Parang sinabi niyo na lang pong ganito po yan Kakain ako ng lechon kasi may statin naman ako. Di ba? Marami pong ganon ang ginagawa
Okay. Thank you, Dr. Joey. Lion Gwen, go ahead. Next question, please.
Yes po, this one po is very parang trending, right? This day is, sabi dito, intermittent fasting is becoming popular. Is this okay for people with diabetes?
Actually, yes, it is. There are now studies that are being done for intermittent fasting, and it seems that they have good output of that. But we still have to wait for more studies. But there seems to be a trend that intermittent fasting may be good.
Doc, is intermittent fasting similar or the same with eating small frequent meals for with people with diabetes?
Ang intermittent fasting po, meron po kayong tinatawag na prolonged yung time of not eating. Yung small frequent meals, maybe probably call that as yung low caloric diet po in general po ang tawag doon. Yung intermittent fasting, you really, for example, kung iba nauso yung, parang sinabi na natin yung mga after 6 diet, parang ganun po yan eh. It's almost similar to that. After 6, wala ka nang kakainin, kakain ka na lang the next morning ng 6 o'clock, so 12 hours fasting ka. So it's almost similar to that. And they are that's we call the time restricted feeding po ang tawag doon. Yung intermittent fasting, they call it the time restricted eating, so or fasting. So may iba-iba pong versions niyan. Merong iba every other day eating, merong iba weekend eating, weekend cheating, pero fasting ka na Merong iba nagbabawas lang po ng breakfast or lunch kung saan yung large meal of the day na tinatagalan pa na yung meal.
Hilak mo
meal
ulit.
time. Minimiss nila yung lunch time pala. Kunyari, breakfast, walang lunch, dinner. Ganon. So there are different forms of intermittent fasting. But the most common one is what we call yung time restricted.
Next question from media. Dok, kaya pala media Betis, marami tayong question. Ito parang kay Dr. Jonas Del Rosario. Ano po ang symptoms ng juvenile diabetes handling children patients as a pediatric cardiologist? And meron po bang pre-insulin sa mga can't afford to buy insulin dahil si Doc nasa Philippine General Hospital? Doc Jonas, please. Pops, please unmute Doc Jonas.
I think yung symptoms po ng juvenile diabetes in general, pareho rin ng diabetes symptoms na in adults na inilista ni Dr. Joey kanina, yung sabi niya mga members daw ng frating gutom, frating frating na umiihi. Isang importante nga yung weight loss, so sila yan, sila yung mga diabetes kasi pareho lang din naman yung issue is talagang high sugar in the blood, Now with regards po dun sa tanong nyo sa mga underprivileged or indigent patients po na may diabetes, talagang mahal yung insulin. At kung ikaw ay pasyente ng PGH or other government hospital, they will provide insulin po. Meron na po kaming budget dyan sa PGH allocated for patients who will need insulin. But you have to be obviously a patient of PGH. Siyempre, dadaan po kayo sa proseso na magre-register either sa dispense sa OPD or marami po sa aming mga pasyente ay first time na naging pasyente ng PGH dahil na-admit po sa ospital. So, we support these children po.
Thank you, Doc Jonas. Next
Ako,
question.
Rolly, singit lang ako.
Go ahead.
Oo. Mga doc, alam kasi yung kapatid namin hanggang mamatay ng 56 injection. So alam namin yung presyo niyan. Is there a way now wherein the insulin is no longer injectable para makabawas sa gastos? I'm just talking about kasi we know that without insulin, yung type 1 lalo na, hindi pwede, di ba? Nagkakaroon ng hyperglycemia sobra. Is there now a new medicines that's being developed na makakamura ng konti? Sorry, I mean, I know how much it costs. It's parang 2,000 every 5 days o 1 week yata yun. Ganyan ba yun?
Natin kay Doc.
Okay. Ganito po. Let us hope and cross fingers kasi po yung may bago pong gamot ngayon yung GLP-1 receptor analog. Okay? Yan po ay injectable na na-develop na po ng isang company na ginawang tablet and under study na po yung gamot na yon for people with diabetes. Now sila po gumagawa rin ng insulin. Now hopefully yung ginawa nilang what you call this design of the drug will hopefully be duplicated sa insulin. Kasi remember po, insulin po is a protein molecule. So once you digest it, masisira lang po. Kaya wala pong tinatawag na oral insulin. Nag-trial po sila ng parang encapsulate or nag-trial po sila ng iba-ibang form pero nadadigest po eh. Now, there was an inhaled insulin. Unfortunately, for it to be very effective, you need very, very high doses para po magamit yung insulin inhalation. Na kung sasabihin yung pong pagbagong labas to magiging mura, kaya hindi pa po kasi may patent po yan, di ba? So matagal po. So ngayon naman po, ang government naman po, nag-mandate po na magkaroon ng drug price reduction. So doon po sa mga nakakagamit ng insulin before, medyo po nagmura na po ang insulin po ngayon. And if you go to the right connections, meron pong tinatag na Insulin for Life program. So alam ko po ang Diabetes Philippines, ang PSEDM, Philippine Society for Diabetes and Endocrine Metabolism, pati yung sa amin po, yung Alliance of Clinical Endocrinologists, meron pong program na tinatawag na Insulin for Life program na nagbibigay po kami ng free insulins sa mga talaga pong indigents. As long as they are qualified to do so, may mga requirements po, nagbibigyan po namin yon. So, puntahan nyo lang po yung mga sinabi kong groups at you maybe inquire from their office. Ulitin ko po, Diabetes Philippines, PSEDM, at saka yung Alliance of Clinical Endocrinologists. You may ask for their Insulin for Life program. Meron po.
Doc,
and they might get it for free.
Ayun na nga. Thank you, Doc Joey. Next two question. From our Executive Secretary, Lion Jamil Kaaway, how does eating in between light meals help control blood sugar? How does eating in between light meals help control blood sugar?
How does eating in light meal, para pong, in other words, parang merienda. In other words, no? Yes, the ano dan is to lessen po yung load of meal during your main meal times. Okay? Kasi po, yung glucose, we call it glucose excursion. So if we eat a lot, okay, or imagine, pag kumakain po kayo, dapat yung habang kumakain kayo, yung insulin nyo po, afterwards sasabay sa ganyang level. Okay? So if you are eating only for 3 main meals, ang lakas nyo kumain, and your pancreas can only do so much. Gaganon lang po siya. Ayun. Hanggang doon ang habol niya. Di ba? So, in order for you not to eat too much, lagyan natin ng mga in-between. Okay? Kasi during your meal, yung snacking, meron din po namang insulin response yun eh. Okay? So, yun ang concept po dyan. So, if you lessen yung tinatawag nating large amount that you eat by means of doing some snacking, then you might probably somehow able to cope up with that insulin response. Sasabay po. Unlike yung ganyan, no? Yun, gano'n, no? Kasi walang meriat, gano'n na naman. Gano'n lang. So yung glucose excursions nyo may be too much, and ang tawag namin yon yung glycemic variability. Kung nagkaroon po kayo ng masyadong variable ng glucose highs and downs, yun po ang nakakasama sa complications. Yung variability of glucose. So kung meron kayong consistency gano'n, mas maganda po yun. Yun. So that's how it may have an effect.
Lion Gwen, partner, any more questions? We will be entertaining at 2 to 3 more before we proceed with the closing. Go ahead.
Yes po. Ako din, Doc, personally, I am so curious about this question. Galing sa kasama natin si Josephine Aguilar. Ang sabi niya, Dr. Joey, when you say frequent urination, as one of the symptoms, how frequent is frequent? When you drink at least 1.5 liters of water a day and you're taking losartan potassium plus hydrochlorothiazide in the morning, you usually urinate more than 8 times a day.
Alam mo, ang pinaka-best niyan, yung tinatawag nating nocturia, yung sa gabi. Kasi commonly, when we go to sleep, at most, isang beses lang tayong gigising sa ihi. Di ba? Now, if you have diabetes, your nocturia is very much what you call this remarkable. You will be urinating 3 or more times. Wala naman siyang definitive definition of polyuria. But nocturia mas maka-qualify natin in a way. Now, if you urinate 3 times or more during the night, then that is a suspicion of already having yung tawag nating polyuria. Okay? Daytime, wala namang actual definition, pero you will notice almost every hour na iihi ka. And yung ihi mo is almost marami. Hindi yung pakonti-konti lang. Okay? Now, for men who having these symptoms, you might mistake it as diabetes already. But having prostate disease can also have the same symptoms, yung nocturia po. So if you have that, you might suspect yourself. The best way is just to suspect yourself of having diabetes, magpapacheck ka lang ng sugar. So these symptoms lang naman are way of probably telling yourself, baka I might have diabetes. Okay? Pero you don't use that as a definition. You use that as describing as being possible diabetes. So nocturia for me, nocturia best way of somehow quantifying it.
Doc Joey, is it regardless kung baka evening ka nag-load ng lots of water than earlier the day? Hindi po ba leading factor siya na talagang mas magiging frequent yung urination mo in the evening? As you said, usually it should be just one.
Yeah, usually, yes, just one. You don't naman usually kasi when you drink water at night, at most, diba sabi ko, normally can also urinate one and middle of the morning tapos gigising ka na. Diba? Usually, that's the common thing. I'm saying kasi wala naman talagang quantifying definition of how frequent you should be urinating. But somehow, yung more than 3 times of urinating at night, waking up yourself 3 times, may be a suspicion that you already have polyuria. Okay.
Lion Gwen, can you ask the last 2 questions before we continue?
Can I be allowed 1 question?
Okay.
Doc Rolly? Ako muna Okay. Kasi Doc Joey, Doc Jonas, di ba we always are advocating ng blood glucose screening. Ang tanong ko ngayon, because nga it is random, di ba? I know na what is your recommended borderlines para, kasi baka naman matakot yung tao, sabi, oy alam may diabetes ka, taas na more than 200. Kasi baka naman hindi nag-pass, ganyan. How do we para lang sa amin kasi kami mga layos mahilig kami ngayon mag-screening.
Yung binigay ko yung definition kanina po na yung random nyo should be not more than 200. Okay? Now, if they have more than 200 and they have symptoms, yung what we call catabolic symptoms, ano yung catabolic symptoms po? They already have some form of weight loss. Nandyan po yung 3 Ps, yung polyuria, polydipsia, polyphagia. Then you already have a suspicion that the patient has diabetes. Na kung wala naman po, then you can do the tests again. You can just do the test twice po on different occasions. That will just give you a suspicion. Kaya screening lang naman po yun. Just to remind, baka, tapos you just tell them, meron ba kayong family history of diabetes? So that adds more to the risk factors of having diabetes.
Lion Gwen, go ahead.
Yes po. So from Subic Bay Centennial, our VP Freddy, ang tanong niya po, recommendation of home remedy or effective helpful herbal medicine. So since nabanggit niyo din po naman kanina, Doc, na we cannot claim yung therapeutic effect ng herbal medicine. Please, helpful lang po.
Ako, pagdating sa herbal, basta gulay. Gulay po na nakakain, high in fiber, yan po ang effective herbal. Now, hindi ho lahat ng herbal medications ay safe po, ha? Minsan ang binibigay kong example lang po dyan, hindi naman po lahat ng kabute safe. May mga nakakalason po. Okay? Hindi naman po lahat ng damo pwedeng kainin. So, kung yan po ay gulay o nahango po sa gulay, ang nire-recommend ko, kainin nyo na lang po yung gulay. Kung yan po ay nahango sa prutas, kainin nyo na lang po yung prutas. Kasi mas meron siya pang nutritional value if we take it as such. So, ang fiber po kasi, what fiber does is that if you add fiber in your diet, it delays the absorption of sugar in your gut. So the more fiber, the less yung chances na ma-absorb siya fast yung sugar. Kaya nga dyan na-advocate yung brown rice. Kasi nga po, o yung unpolished, kasi may fiber siya. Nandyan po dumating yung wheat bread. Okay? Hindi po sweet bread, kundi wheat bread. Yan po, high in fiber. So it delays the absorption of your sugar from the carbohydrate once it's digested in your gut. So, yun po ang take ko po doon. Kumain po kayo ng gulay. Yan.
Doc, may nagtatanong yung popularity na insulin plant. What can you comment about the insulin?
Okay. Wala pa hong proof ang insulin plant. I think nga po it's a misnamed plant kasi hindi naman po yan gumagawa ng insulin. Hindi naman, ito na lang po for sake of yung argument. Ang insulin po by itself, it's a hormone. It's a protein hormone. So anumang pong protein na pag ininom nyo, kinain nyo, madadigest po yan into amino acids. So it's a misnamed plant kasi po, yung insulin, hindi po pwedeng gumawa siya ng insulin. O kung gumagawa man siya, sabihin natin for argument's sake, gumagawa siya ng insulin. Pag kinain nyo po yan, madadigest lang po yan into amino acid, number 1. Okay. So hindi ko po alam ang storya behind insulin plant kung paano po siya naturing ang insulin. Pangalawa, pag ganyan pong mga halaman, wala pa hong extensive na pag-aaral. Number 1, anong parte ng insulin plant? Dahon ba, tangkay, o yung roots? O bulaklak, kung may bulaklak ba? Number 2, ganong karami ho ba?
Dapat kainin.
5, 3, 4, wala. Number 3, gagawin bang tsaa? Gagawin pang gulay? Dudurugin ba? Igigisa ba? Lulutuin ba? Or hindi? Iihawin ba? Who knows? None. So, isipin niya rin po natin na sa may mga gamot na galing pong halaman, totoo naman po yun, pero yan po ay na-purify. At sa isang halaman, pwedeng panggalingan ng 7, 5, 4 na chemicals na pwedeng ma-purify. Now, paano po kung sakasakali may insulin man siya? Paano kung meron po dong isang parting chemical na hindi nararapat sa iyo? Delikado po. Okay? Kaya nga po, ang proseso ng paggagawa ng gamot ay mayroong tinatawag na purification process para malaman eksakto alin doon ang naging effective. Aling parte doon o substance doon na naging effective po para doon. So, hindi po natin pwede ma-generalize. So, hindi po natin marirecommend siya. Kaya nga tinatawag na to therapeutic claims sa food kasi wala pang pong pagpapatunay na ito po ay nakakagamot. At pangalawa, wala pa rin pong pagpapatunay na ito po ay safe, lalo na long term. Okay, so mag-iingat po tayo. Siguro magtanim na lang po tayo. Who knows, maybe in 10 or 20 years, pag yan po ay napatunayan, then probably, may marami na kayong tanim, yayaman po kayo. So, sa ngayon, wag po nating i-recommend. Okay? Yeah, same is true for doon sa mga naking kwento about yung sa ampalaya. Diba? It was a fad before, pero ngayon, nag-die down na po kasi nalaman po yung kwento behind ampalaya leaves na it should be in a tea form. Meron po yung certain areas na effective. If not, alam ko yung kwento po niyan yung first from top to bottom na leaves na certain. Tapos yan po ay may certain location lang na kung saan po siya dapat itanim, 1 kilometer away from the road. At yan po ay para maging effective, if I'm not mistaken, yan po ay parang 15 capsules. So parang nalugi lang po kayo sa pagbili at paggamit. So kainin nyo na lang po yung ampalaya.
Thank you, Doc. Our last question na, Doc, for tonight. Yung stevia po ba is really a good alternative as sweetener para sa ating mga sa person with diabetes? And ano daw po ang best diet for people who have PCOS in combination with high sugar or yung pre-diabetic po?
Okay, yung artificial sweeteners, we have a lot now. We have stevia, we have Splenda, NutraSweet, Equal,
Diabetazole. Diabetazole po.
Hindi, siya po ay milk-like based food formula. Hindi po siya artificial sweetener. Ang mga artificial sweeteners, yan po yung mga maliliit na tablets or yung mga sachet na found to be tasting sweet but has no calorie. Okay? Safe po siya. Safe naman pong gawitin. Lahat po sila safe naman po. Na yung iba lang po, hindi pwedeng gamitin pangluto tulad ng mga NutraSweet, Equal. Pag tinluto po yan, nagiging pong masyadong mapait. Ang pwede pong pangluto ay yung Splenda. Yung stevia naman po, I'm not sure kung pwedeng pangluto ako, hindi pa ho, but it's also a safe artificial sweetener as of the moment. Yung concern about cancer na nagko-cause daw ng cancer itong mga po ito. As far as I know, matagal na pong issue yan, pero ang sinabi po sa amin noon na para maging cancerous po yung mga equal or NutraSweet, it will take about, kung equivalent po sa Diet Coke, it will take about 18 cans of Diet Coke in a day for it to cause that for a long-term use. So that's how safe it is po. Okay? Na-convert ko siya, tinatawag sa wood alcohol, which is noted to be, if taken in excessive amounts, doon lang po. Now, yung sa PCOS naman po, yung diet ko pong pinakita kanina, yung plate method, effective din po yon sa may mga PCOS. Kasi it helps in reducing weight, it has less caloric, it has less carbohydrate, more on high in fiber po siya, and equally nutritious naman din po.
Alright. Thank you very much, Dr. Joy Miranda. Doc, itataas ko yung aming regalo sa inyo. Virtual muna ngayon. Magkalayo po tayo. This will come to your clinic and office anytime soon.
Maraming salamat po.
Lion Gwen, let's proceed.
Yes, look, we would also like to acknowledge and recognize participating clubs in alphabetical format. First, we have from District Tier 1D2, Bataan Host Lions Club. Binangonan, Santa Ursula Lions Club. Marikina City Lions Club. Marikina Valley Host Lions Club. Pasig Host Lions Club. Pasig Bayanihan Centennial Lions Club. Quezon City Cubao Lions Club. And Quezon City Kawilihan Lions Club. Also, our committee from QCLC chose 2 clubs to highlight and especially be recognized. Let us have Quezon City Metro Novaliches Lions Club. Let's give them a big round of applause. And finally, our benevolent friends from Subic Bay Centennial Lions Club. Let's give them a well-deserved applause.
Congratulations. Thank you, Lion Gwen. Fellow Lions, friends, ladies and gentlemen, our home club, Quezon City Cubao Lions Club, came out with a small contest of different clubs in our district who have done diabetes awareness and action service activities. So we can watch now this very beautiful audiovisual presentation on how our different Lions clubs mentioned by Lion Gwen made their mark in celebration this November for the World Diabetes Awareness Month. Lion Pops?
Bago yan, sorry, Tres, meron pala yung Rodriguez Montalban. Yun na nga, hindi ko, sorry ho, natataranta na ako sa daming nagbigay. I will correct that later. All of the participating clubs will receive their certificates. Tapos, pinangako po namin yung dalawang ni-recognize, magkakaroon ho ng konting, bibigyan pala namin ng ting-isang dagdag na glucometer ang Subic Centennial at ang Quezon City Metro Novaliches. Dali po, ito po yung summary ng ating ginawa bago tayo nagkaroon ng bago ang World Diabetes Day.
Comes a time when we heed a certain call, when the world must come together as one.
There are people dying, and it's time to lend a hand to life, the greatest gift of all. We can't go on day by day that someone somewhere will soon make a change.
We are more
giving. There's a choice we're making. We're saving our own lives. It's true, we'll make a better day, just you and me.
Send them your heart, so they'll know that someone cares, and their lives will be stronger and free.
As God had showed us by turning stone to bread, and so we all
Must lend a helping hand.
we are the world, we are the children, we are the ones who make a brighter day. So let's start giving.
There's a choice we're making. We're saving our own lives. It's true, we'll make a better day, just you and me.
When you're down and out, receive the hope and all. But if you just believe, there's no way we can fall.
Change can only come when we stand together as one. We are the world, we are the children, we are the ones who make a brighter day. So let's start giving. There's a choice we're making. We're saving our own lives. It's true, we'll make a better day, just you and me. We are the world, we are the children, we are the ones who make a brighter day. So let's start giving. There's a choice we're making. We're saving our own lives. It's true, we'll make a better day, just you and me. We are the world, we are the world, we are the children, we are the children, we are the ones who make a better day. So let's start giving, start giving. There's a choice we're making. We're saving our own lives. It's true, make a better day, just you and me. We are the world, we are the world, we are the children, we are the children, we are the ones who make a better day. So let's start giving. There's a choice we're making. We're saving our own lives. It's true, make a better day, just you and me. We are the world, we are the children, we are the ones who make a better day. So let's start giving. There's a choice we're making. We're saving our own lives. It's true, make a better day, just you and me. We are the world, we are the children, we are the ones who make a better day. So let's start giving. There's a choice we're making. We're saving our own lives. It's true, make a better day, just you and me. We are the world. It's true, make a better day, just you and me. We are the world.
Line Gwen, please proceed.
Yes, Doc. Can you do the honors, Doc, to mention our sponsors?
Yes, now we acknowledge with much thanks and appreciation our supporting groups and organizations, Roach Philippines, Smile from Heaven Foundation, Philippine Diabetes Support and Awareness Group Incorporated, and our esteemed fellow lions and families from all 53 clubs in our district and the other districts. Live stream viewers in our Facebook page of Quezon City Cubao Lions Club. There are also some lions from other countries. So we'd like to thank them for joining our webinar this evening. Go ahead, Lion Gwen. Special.
As you said, we would like to acknowledge our esteemed fellow lions and families from all over 53 clubs in our district 301D2 and all other districts from our MD 301 Philippines. Thank you very much. Also, special thanks to our medical consultants and specialists together with our media partners. We will now have our photo opportunity online. And again, thank you, and let us all continue the fight against diabetes. This has been your host, Lion Gwen Savio Manapa from Rizal Metro Lions Club.
And I am Dr. Rolling Connection Jr. from our home club, the Quezon City Cubao Lions Club, saying good night and see you all in our World Diabetes Day event 2022. Stay safe, stay well, and stay away from sweets. But you can stay sweet in caring for others in our continuing fight against diabetes. Fellow Lions, we serve.
Thank you rin ho kay Architect Cynthia.
Architect Cynthia, thank you very much. Also, the C-Tablet sponsored by Helix. Thank you very much, Lion Cora Sempio. Lion Pops, can we have the photo opportunity? Maybe invite everybody still with us. And thank you for our live stream viewers in our Facebook page.
Sige, naka-ready ako ha. Medyo smile lang kayo ng matagal. Hindi ko alam kung saan kayo nakaset ha. Okay, o, sige. 5 ho ito, 5. Smile! Thank you doon sa mga dignitaries na hindi na namin nabate.
Yes, to our line dignitaries, past council chairpersons, past governors from all the districts in our multiple district 301 Philippines. Lion Pops, even our Area 5 Global Action Team Constitutional Area Leader, PCC George Ongtan, invited the other countries that are included in our Constitutional Area 5.
One more time. Pakibukas ho yung mga video, puro pangalan nakita ko eh. Thank you. Ulitin natin. Ito yung first. Smile! Meron na akong bagong recruit, yung anak ko na nag-aaral sa Ateneo, kasama natin. Yan ho yung nagre-reklamo kung bakit daw kailangan ng kanin. Sandali. Ito mga Lion Esther, please, pakibuksan nyo yung camera nyo, hindi namin kayo makita. Sorry po. Ayan, thank you. Lahat ho, thank you. Yung mga taga-Cebu, Lion Henry, pakibukas yung camera. Ayan. Thank you.
May tanong pa raw kay Doc Joey. Doc Joey, bakit daw yung sabi, yun daw matatamis na pagkain, yun na nagkakos ng diabetes? Yung kanin, wala naman lasa yun, wala rin tamis yun. Pero ang taas ng glycemic index, Doc, ba't ba ganun?
Pag na-digest po yun, magiging sugar din yun. Magiging glucose po siya.
Salamat po ng marami.
Bye. Doc Joey, thank you very much. Dr.
Thank you,
Jonas,
Doc Joey.
Architect Cynthia, thank you.
Thank you,
Lions, ladies and gentlemen.
Okay, teka muna. Isa muna ng palakpak na malakas para kay Doc Jonas Del Rosario for receiving honors from our government. Ano yun? Isa ka lang, Doc, na nanalo doon, di ba?
Hindi, madami din.
Ganon. Congratulations ulit.
Salamat po.
Thank you, Doc.
Thank you rin din sa mga sumali. Sorry ho, Lion Dong. Hindi ko na isama yung pangalan ng club nyo, pero bibigyan ho namin kayo certificate. Lion Louie, nandiyan ka pa ba? Yung bang mga clubs ay district, tutuloy nyo ba yung plano nyo na paki-announce nga yung plano na yun? So, Lion Louie. Yung tungkol sa glucometer.
Chairman, unmute po.
Yeah.
Hindi po nadidinig.
Thank you po. Thank you very much for everyone for attending our webinar. We'd just like to announce that because of the support of the multiple district 301 Philippines, we have decided, the club decided to give each district governor, Council Chair Pons Yuson, and our diabetes chairman, Anson Ong, 1 glucometer each po. Tigi-tigisa po yung member ng COD. Salamat po. Thanks. Madadala na lang namin po sa inyo. Thank you po. Yeah, Pop, thank you.
Thank you very much. And see you, fellow Lions, ladies and gentlemen, on World Diabetes Day 2022. But still, we will continue the fight against diabetes as the whole month of November is the Diabetes Awareness Month. Magandang gabi po sa inyo lahat.
Plug. Yung Cebu, next week, 7:30, meron din silang webinar. Si DC La Esther Yu ang in charge. A-attend din kami. Maraming salamat sa inyong lahat.
Montalban Rizal Lions Club, thank you for sending and doing your diabetes project. Best friend Cap3, Dong Lunario, thank you very much. Magandang gabi and best regards to all clubs in our district.
Joey, thank you. Joey Encarnacion, thank you.
Bob Cherry, thank you very much. And Council Chair Pons Yuson, maraming salamat po sa buong suporta.
Alam nyo, nung ginagawa ko yung sige ho, yung gusto nang umalis. Thank you ho yung sa mga taga-Pototan. Sa Iloilo po yun. Papunta ng Boracay. Sorry, yun na naalala eh. No? Nung ginagawa ko yung video, naiyak ako talaga. Ang daming nagagawa ng Lions pag mabilis, pag nagsasama-sama. No? Nakita niyo yung video? Wala hong planuhan yun. Ganong pinagsama-sama. Basta sinabi ni Gob Cherry, gawin nyo, ginagawa na. O nga pala, announcement doon sa mga hindi nakakaalam pa. Sa Wednesday, may meeting, di ba Gob?
Special cabinet meeting.
Special cabinet meeting sa Wednesday. Nire-remind lang namin kayo.
Thank you.
Thank you po sa lahat.
Okay, thank you so much. Everybody, thank you. Good night.
Good night, Gob. Good night. Lion Gwen, thank you.
Welcome po.
Gob
Gwen,
Cherry,
thank you.
Gob Cherry,
Yes.
congratulations. Nanalo ka
Why?
sa raffle prize
Yes.
ng Cubao.
Thank you.
Oy, teka, saan pupunta yung Pangulong Carol, kanino mo ibibigay yung mga yung diabetesols? Meron pala yun, 24 case papax.
Okay. Lahat ng 53 clubs, malamang di-divide yan.
Hindi, yun mo nang siguraduhin natin lahat yung nagpadala ng mga litrato, bigyan na natin yon. So, di ba?
Thank you.
Tapos yung mga dumalo dito, gaya ng Damayan, papadala natin.
Thank you.
Pangulo, Rizal Metro Lions Club, manghingi rin po ng allotment.
O sige, dahil at saka yung mga media partners natin, pagbigyan natin diabetesol.
Maraming salamat, Council Chairman, Past Council Chair George Ongtan for the diabetesol. Thank you, Chairman.
Lion Esther, pinlag ko na ho yung inyong seminar next week.
Chairman, kung nandito pa, si Bohol Chocolate Hills Lions Club, kasama din natin sila kanina.
Nandiyan si Lion Esther. Lion Esther, siya ang dun DC, di ba? Lion Esther yun. Pakisabi ho sa lahat ng mga naggaling sa inyong district. Thank you.
Congratulations, Congratulations to all of you for a very successful webinar tonight.
Oo nga po, salamat po. Oo.
Thank you.
Thank you, Lion Esther. Thank you so much.
Marami din naka-attend galing sa amin.
Salamat.
Okay. Next Sunday.
Next Sunday, attend ho kami sa inyo. Alas 7:30, ho?
Oo.
Bigyan niyo kami ng link para ma-share namin sa amin.
Oo, sige, padala kita.
Salamat po.
Thank you, thank you.
Ayun, nandito pa pala si
Congrats.
Sister,
Congrats
si
again.
President Viola C. Taga ano yan eh? Tama ba ako? Putotan ho kayo?
President namin yon. President namin yon, Viola C.
Ganun po. Ayaw po.
President ko yan.
Apo.
President,
Thank you for coming.
President ko sa Cebuan Town Lions Club.
Okay. Thank you po.
Si Johnny Chan nandyan.
Thank you po sa inyong lahat.
Second Vice Johnny Chan at saka yung governor namin kanina nag-attend.
Talaga ho?
DJ
Thank
Roger
you.
Aligarbes.
Ay, oo nga. Pasensya na. Sabihin nyo, hindi na mabatik. So, kulang na kulang sa oras. Ang dami pang question, di
Kanina
natapos.
meron din marami naka-attend sa amin.
Oo nga, napansin ko nga ho, meron
Congrats
pati hanggang sa yung pating mga taga ibang lugar. Wala yata sa Samar, ano?
Oo, kasi may taga Bohol nag-attend yung district namin. Taga Bohol, taga Lapu-Lapu.
O yan, imbitahin niyo si Lion Esther, imbitahin niyo si Lion Gia para mag-imbita ng mga press. Ayan, nandiyan pa ho, naka-online pa. Lion Gia, tulungan mo raw yung B2 sa kanilang seminar sa next week. Ayan daw, ayan, nag-hinart po, okay na yon. Tutulungan ho kayo niyan, i-connect ko na lang ho kayo.
Sige po. Salamat. Dayan Pops.
Gob, nanalo ka daw? Anong pinanalunan? Lion Rolly? Ano pinanalunan niya, Pangulo ni Gob? Gob, Pangulo, naka-mute ka.
Mute.
O, yan. Ano na panalunan ni Gob?
2 prize ang napanalunan niya.
Talaga?
Wow!
Vacuum cleaner. At saka air fryer.
Wow! Gob! Dalawa panalo mo. Magagalit sa akin niya si Chairman George. Wala pinanalunan kahit isa.
2.
Sila yung Bing, nanalo ka rin pala. Bing Sabio, nanalo ka din.
Opo.
Ano pinanalunan ni Lion Bing?
Padadala ko na lang sa district, Gob. Padadala na lang sa district yung kay Gob.
Thank you.
Hindi. May meeting sa Wednesday. Padala mo na kay Lion Louie.
Yes, oo.
Okay, salamat. Maraming salamat sa inyo. Thank you so much.
Salamat po. Good night.
Good night. See you all.
Sige po, out na kayo. Hindi na ako maka-out. Ako yung huling out. Ako yung host.
Congratulations po. Congratulations.
Oo, kasi
Salamat
alam nyo,
po.
nagtagal sila kasi magaganda yung mga nakikita nilang mukha. Hindi, pero Gob Jerry, ang daming governors na tumulong,
Oo, nakakatuwa. Nakakatuwa naman. Ang dami talaga nakibahagi sa atin. Ang daming tsaka maganda yan kasi awareness talaga. Yes, Lion Esther, by you. Di ba? Talagang tayo. Ano tawag dito? Twin clubs. Di ba? Twin district, di ba? Kaya andyan, ganyan ang support. Sister district.
Bito andito.
Oo nga, tama. Oo.
Kaya magtulong.
Para tayong magkakasama na talaga. Thank you so much.
Ang nakakalungkot lang, hindi na nakita ng kasama namin si Lion Roger, namatay siya. Nilibing ko kanina.
Oh my gosh, sayang.
Ang namin, nandito kanina yung district governor namin, si DJ Roger.
Oo.
At saka second vice, Johnny Chan.
Oo nga ho. Hanggang ngayon, nandiyan pa nandito po. Good evening ho. Second vice Johnny Chan, nandito pa Thank you very much po.
Mother-in-law, Viola C is the mother-in-law of Vice Gov Johnny Chan.
Hi! Ayan siya, okay.
Good evening po.
Andyan si past council chair namin, Nestor Chua.
Yeah.
Oh, Johnny
Past
Chan is
Council
there.
Chair! Nestor, hello po.
Congratulations!
Nice to see you again. Ang tagal na po natin hindi nagkita.
We will see you soon. Congratulations.
I'm happy to see you. Okay, opo.
Likewise,
Salamat.
likewise. Thank you.
Opo.
Vice Gov Johnny.
Second Vice Johnny, yes.
Unmute yourself.
Thank you for inviting us. Thank you so much. Oo.
Thank you all for attending and
Maraming salamat sa inyo.
Bob, past council po. Thank you very much.
Don't forget November 21.
Sige, i-announce ko. Kukulitin ko yung mga taga-district namin at saka ibang district. Re-remind ko talaga.
Sa inyo naman yan. Okay, very good.
Kayo ang bahala. Kayo ang mag-invite dyan.
Sige. Pagka taga dito, bahala si Paps dyan.
Punuin natin ang venue.
Opo.
Para maraming matuto, 'di ba? Maraming matutunan.
Yes.
Actually, meron ang isa sa mga concern ko talaga yung may mga diabetes na kailangan insulin, hindi na maka-afford eh. Yun ang mahirap eh.
Pero ngayon may mas mura talaga. May mas mura talaga. Tsaka maganda yung paglilinaw tungkol sa metformin.
Oo nga, akala ko talaga totoo yung sa metformin na mas mabigat yung cancer ng ng mga sweetener. Akala ko totoo yun, hindi pala totoo yun. So pwede na tayo uminom ng Coke ngayon na zero.
Bawal pa rin kasi nga kahit pa ano pa sabihin mo, ano pa rin yan, carbonated pa rin at the same time may sugar content pa rin yan. Yun lang yun, 'di ba? Kaya nga matamis eh. Bawal.
Medicine is medicine pa. So,
yes, pinakamaganda na lang tubig. The best
Oo
is
nga,
water.
totoo lang.
Best water.
Mas okay talaga water.
Oo, kay kung ano pa inumin natin, yun na. We have enough for,
pero alam mo, Gob Cherry, isang ang tanong ko, paano yung maraming kain nakakatulong? Yung nga pala ang sagot, nakakahabol yung production ng insulin ng pancreas.
Tama.
Oo nga.
Nakamute man sila, iba kanil on.
Pero masarap daw, maganda na rin yung tinatawag nating intermittent eating, intermittent
Josea Rafael.
You make 12 hours apart ang kain ulit. Kaya
ito yung
tama
anak ko,
yung
Gob.
after 6. Yep.
Gob, yung anak ko yan, si Josea. Ayun daw, pagkalampas daw ng alas 6, huwag ka nakakain.
It's just, parang pinakamaganda na rin. Kasi pagdating ng gabi, mahina na yung
pantunaw.
Digestion natin. Oo, kasi wala na tayo inactive na, matutulog na. So I think it's really best to eat before 6 o'clock.
At saka ang sabi nung doktor, anak, kainin mo ng lahat, yung huli mo yung kanin para busog ka na, hindi mo na masyadong kakainin.
Tama. Tama yun.
Ano ho yan? Puro scholar Gob ng Ateneo. Second year.
Wow, congratulations.
Kung sa tatay niya siya aasa, naku, baka sa public school na hindi pa kaya.
Hindi, pero maganda kasi you see, talinong bata.
Gwapo pa, hindi mana sa ama, no? Tingnan niyo layo.
Gwapong-gwapo at saka tsaka susunod yan sa pagda-diet para lalong gagwapo, di ba?
Isa lang ang natutunan niya, nakuha niya sa akin, marunong magsulat.
Very good. Nice.
Editor-in-chief nung high school.
Wow. The proud father.
Oo naman.
Proud dad. Oo, dapat. Gwapo na, matalino pa, di ba? Oo.
Thank you sa inyo lahat. Hindi ako talaga makaalis hanggang nandiyan kayo.
Okay, bye-bye.
Gwen, nice to see you, Gwen. Thank you so much.
Healthy, yun ang importante.
I miss you so much.
Likewise.
You're so pretty, you're so beautiful. Nakita kita naka-gown sa anniversary ng Subic Centennial.
Oo, talaga.
gorgeous.
Nakita mo ako naka-off shoulders that time.
Oo.
Ganda. I'm so proud sa governor namin. Ang ganda-ganda.
Oy, salamat. Salamat. Pare-pareho lang yung magaganda na pupurihan.
Yan.
Gob, hindi ka nagpadala. Anniversary pala ng club nyo. Hindi ka nagpadalang pansit.
Walang pansit eh. Macaroni salad.
Ganun.
At saka baked mac. Puro nga nagkasama sa kanya-kanyang dala. O, di ba? 71 years na kami.
Nauna pala kayo sa amin na mahigit na 20 taon, ano?
Yeah. Ang tanda na ng Pasig Host. Nakikita naman medyo matanda na rin yung mga miyembro.
Hindi, pero nakita ko nga may bata kayo. Meron na kayong second generation.
Yeah. Kailangan. Kasi hindi mo masabi panahon, di ba? Kami nga, medyo... At age 64, what do you think? O, di ba? Ilang panahon na lang yan.
Aba!
Kaya we need some other young blood to run the club, di ba?
Gob, ano na ba yon yung meeting ba natin? Ano na yon? Done deal na? Yung sa Wednesday?
Yeah, it would be on Wednesday, ha? It would be on
Hindi,
Wednesday.
sabihin wala nang problema yon. Okay na yon? Sa
Okay na yan,
international
okay.
ba? Good yon?
Yeah, kasi we are on board. Everything on board, okay?
Ay, very good.
Walang problema. Sige, magkita-kita, kits.
Bye-bye po.
Bye-bye, good night.
Good
Bye-bye.
O-off ko na ho, ha? Bye-bye.
Sige, bye-bye.